I'm going to let Deanna
Recording in
introduce.
progress.
Deanna's going to introduce the moderator of this discussion, but this is the intersection of health and transportation.
Need to read it. I probably won't read it. Good morning, everybody. I'm really excited to introduce Chris Danley, who's going to be moderating this panel. I actually met Chris Danley when he was a transportation planner at ACHD over 10 years ago. And he was already thinking about these things way ahead of many people in this state. And I think it's very much to his credit that in 2011, he formed his company, Vitruvian, and has very persistently worked on the intersection of health and transportation with many communities across since then. So with that, Chris Danley.
Thanks, Deanna. I hate to break it to you, but it was more than 10. A little bit. Super excited to be here. Thank you all for having me. Thank you for Cynthia for the great work that you continue to do year after year. This is a subject that is near and dear to my heart. It's the intersection of health and planning is a good one, and it means the world to me, as Deanna described. So last week, APA, American Planning Association, had its annual conference, and we had a discussion about the meaningful things of your career and what are those milestones. And I thought about that question a lot. You know, wins, places you've been, projects you've been a part of, all things that, yeah, of course, matter. But you know what I realized matters the most? The professional relationships that I've had the great opportunity to forge. And many of you in this room I've known for a long time. This rock star panel of three here to my left are absolutely in that category. I've had the good fortune of knowing all three of them for quite some time, and I'm so happy that they agreed to be here to share their story. So briefly, I want to make sure to introduce the three of them, and then we're going to get started. I want to start with Teresa McLeod, currently Administrator of Community Health and Engagement at St. Luke's Health System. I've known Teresa for quite a while. She interviewed me for Planning and Zoning Commission, so if I screw up, you know exactly who to blame. Teresa here. But Teresa and St. Luke's have been at the tip of the spear for quite some time now. Think about that. Our state's largest employer is full on into that pool of planning and health, right? They have their motivations, which we're going to learn about in just a little bit. But Teresa and her team continue to do great things all over the state. I'm super happy to call her not only colleague, but friend, and thank her for being here. Next up, Nick Foster. Oh my gosh, Nick. Nick is here. He's a great engineer and planner with Kittleson and Associates. He has done some of the most incredible work that I've seen, especially in the bicycle pedestrian realm. And I've known Nick for quite some time. We have never had the opportunity to work together. We have an interview in 2 weeks, so don't suck, right? Hopefully we can make that happen. But Nick's work speaks for itself, and he continues to do magnificent things in this realm, and many of the things in line with what Ian was talking about, and we're very grateful for him to be here. And last but certainly not least is another rock star, Alexis Pickering, Commissioner Alexis Pickering with Ada County Highway District. I had the good fortune of meeting Alexis. I think it might have been like in your first week, maybe second week, when she started with Central District Health. And she doesn't know this story. I'm going to embarrass her a little bit. But I was introduced to Alexis by her at the time, boss Jamie Annenson. And about a week after that meeting, Jamie called me. And she says, "Chris, don't you dare hire her away from me." And I thought, dang, I wish I could have at the moment. I wasn't able to. But it was one of those moments where you know you're sitting in the presence of somebody who's going to do fantastic things. And all these years later, here she is, a commissioner at Ada County Highway District, and still doing wonderful things within the health realm itself. So all three amazing people, super excited to have them be here. And now it's time for this monkey to shut up and let them talk. So if I can just have you introduce yourselves with a little bit more detail. Tell us a little bit about you, what exactly you kind of do for work, and then certainly some of your experiences about safe streets, unsafe streets, neighborhoods, the things that maybe why you're even here and the work that you're doing. So we'll just keep it real simple, go from left to right. Teresa, if you wouldn't mind getting us started.
Of course. Can you hear me?
There we go.
Thank you. I needed an engineer. Good morning, everyone. It is really my pleasure to be here with you today. I have to say, walking into the Capitol takes my breath away every time I walk in. And I have been fortunate to have been born and raised in Boise and in this Capitol many times. But anyway, just to be present, to be in this amazing structure, and to be collectively together is just a real pleasure for me
Hey,
today.
Winston, come here.
Good boy, Winston.
So sorry.
So again, I was born and raised in Boise, and I've had the pleasure of working in the private sector, public sector, and now in the nonprofit sector. When I was growing up, I lived in a neighborhood in Boise that did not have sidewalks, and this was back in the day when one roller skated rather than rollerbladed. And I remember always wanting to go down to my friend Christina's house in the North End because they had sidewalks and we could roller skate. And where I lived, we ran around in the trails in the foothills. So definitely a charmed childhood, but my first orientation with the value of sidewalks, interestingly, was as a child wanting to be able to roller skate. I had the opportunity when I worked for the private sector to be pretty involved in the community because my employer believed in giving back to the communities where you lived. So I made a lot of relationships in the work that I was doing, and yet I was kind of a bystander when you think about health transportation solutions. It wasn't until I went to work for Mayor Beater in 2004 and I became involved in managing our neighborhood reinvestment grant program and working with, at that time, 34 neighborhood associations. And I started realizing not all neighborhoods are created equally. That is in part what attracts different neighborhood character. Yet from a transportation perspective, while the city did not control streets, curbs, gutters, sidewalks, we had neighborhood associations, all they wanted in reinvestment dollars was for them to be able to put in sidewalks. And I remember saying to the mayor, that's not our responsibility. And he said, but if it's what the neighbors value the most and they're not able to get it right now, then it is our responsibility. It's all part of livability. So really working for the city of Boise, working for Mayor Beater, particularly helped me understand, and our city council as well, helped me to understand, to really look more deeply in our communities at what I now call social determinants of health because of the work I'm doing for St. Luke's in the health space. So I won't go into a lot of that because I love this work and I could take all your time. But I will say that it wasn't this innate nature of mine where I grew up with this mindfulness of transportation and availability. It really was through my experiences, somewhat personally, very much professionally. And I would say I wouldn't have the sensibility of health and transportation and then the ability to inform St. Luke's responsibility in being involved in it if it hadn't been for people like Chris Stanley on planning and zoning, challenging St. Luke's when we came in front of planning and zoning. If it wasn't for people like Cynthia saying there has to be a walkability component to this, it can't just be cars. Looking at Lisa and saying, what about the safe routes to school? So I'm only here today because people have informed, educated, challenged me in my different capacities so that I now have the sensibility that was not my own. So, thank you.
If I can turn my own on now. All right, yeah, thank you, Teresa. That was great. I won't be nearly as eloquent or as inspiring. It's the whole engineer thing. But it's great to be talking in front of people again. I think this is the first time I've gotten to speak in front of a live audience and not into a camera above my computer monitor in a few years. So this is exciting. Happy to be here with all of you. So yeah, I've been working in the field for 16 years. I did not grow up in Boise. I grew up in the Portland metro area, out in the suburbs, a ways out from the city. I grew up in a large family and the oldest of 7 children. And so taking us everywhere in a car was a giant pain for my parents. And I was an independent kid. And so after I badgered them enough, they started letting me walk everywhere. And that was my first taste of freedom and independence, and where I really started getting interested in, transportation as a way to get places. We would, in the summertime, me and my best friend, we would walk 45 minutes or whatever it was along a state highway to get to the movie theater. Or if we were feeling rich that day, we'd put the money down for the bus and take that. That was a godsend to be able to take a bus, on a hot summer day, or if we're running late for our matinee of whatever terrible movie we were going to see was. And so I started to gain, some appreciation for, if you couldn't drive, there were still ways to get places. There was usually sidewalks where we walked, but not always. It wasn't always pleasant walking along a highway. But our parents let us do it, and I appreciate the opportunity to be able to get out there and do it, and to go places and walk around. And so that was kind of my childhood exposure to the idea that transportation could mean freedom, even if you didn't have a driver's license. You didn't have to wait till you were 16. And I'm thankful that my parents were trusting of me to let me go out, or at least ignorant to where I might have been walking to or biking to, and were just happy to let me be out of the house and not having to be carting me around. Let's see, so I landed in Boise in 2006, started working in transportation. There was not a whole lot of people doing bicycling and pedestrian planning at the time. It was sort of a throw-in at the end of a project or a side thing, and it was something that was important to me and others that I worked with. And we worked hard to kind of push others, both from internal to our own firm as well as on the client side of things. Hey, have you thought about this? Could we add this into projects? And kind of just needled at things until we were able to, secure some other projects that were bigger, more interesting, and see more people, be interested in that type of work. It's been really great to watch the progress as I look back on where we were as a profession in 2006 and where we are now. As a global profession, and as well as here at ACHD, the Livable Streets performance measures are really pushing us into all kinds of new directions locally, and the projects we're working on right now are very exciting. And it's been a really great time to be a professional here in the Valley in this area.
Well, hello, everyone. My name is Alexis Pickering. I'm one of the Ada County Highway District Commissioners. I grew up in Koosky, Idaho. I think most of you probably don't know where that is, but it's up north, and it's a beautiful place to grow up. But you probably also noticed that there aren't any sidewalks, there aren't any bike lanes. There's, big logging trucks that barrel down the 2-lane highway. And, I think there's a lot of foreshadowing in my childhood that, our school district was one of many in Idaho where we are away from the town center. And I grew up practicing for track meets along Highway 12, which is a 55-mile-an-hour 2-lane highway that passes the lumber mill, and there's no shoulder. And, that's like many communities in our state where we lack that infrastructure, and we just grow up with it, right? We don't know how much better it could be, or how the impacts of that lack of infrastructure impacts our trajectory in a variety of ways, whether that's rollerblading or skating or just being able to walk to the grocery store. And so I made my way to Boise as a first generation college student transferring from Walla Walla Community College. Didn't know a soul down here, and lived in the East End in a small apartment. And it was when the city of Boise and ACHD did those protected bike lanes on Jefferson and into downtown, was my first experience with like, wow, this is what biking safely feels like. I had no idea. And then, of course, as many of you probably know, that was taken out really promptly. But I didn't really know how passionate I would be about public health and transportation until a variety of people came into my life, and very grateful that one of those was Cynthia and Chris. Obviously, we hosted my first walkability workshop in Star, Idaho, as a fresh health policy analyst in the local public health district. And Erin was there, Erin Bennett, and so many of you also, Lisa, so many of you helped with pulling that off. And it was at that conversation with the future mayor of Star, city council members, realtors, pastors, parents, and teachers, where we're like, this is not, at the time, Star was one of the youngest and fastest growing cities in Ada County. And, I just felt like this isn't enough. We need to be able to have safe routes for these kiddos to walk and bike to school. We're growing so fast. In my mind, it's unacceptable that we aren't working collaboratively to garner solutions to these shared challenges. And it was through that eye-opening workshop and listening to Councilmember Clegg and others that, we need to get involved. We need to demand more electeds to look at this from an intersectional perspective. And so I got involved with Ada County Highway District as the chair of the Pedestrian Advisory Group. And it was through that experience, learning the inner workings of, the largest county highway district and the only one in the state, that I realized that we needed new leadership and somebody that is willing to bring that health perspective to the table. And so, yeah, I ran for office 2 years ago, won by only 4 votes. So again, local elections matter, every vote matters. And it's been a really challenging and exciting opportunity to usher in some really overdue changes. And of course, we still have a ton more ways to go. But so that's my one hat. And then of course, in my other hat, I continue to work in local public health, which also has my heart. And I get to work with Teresa and also do amazing things across our 10-county region.
Awesome. Okay, so this whole discussion is about this intersection between health and transportation. So I want to ask you a two-part question. Why should anybody care, right? Why should the public health folks care about transportation? And why should the transportation people care about public health? And the other part of the question is, and you kind of touched on some of this a little bit, but are there any other sort of aha moments that any of you have had that would encapsulate why maybe we should care, if you have anything like that to share? What are your thoughts? Same thing, I guess we'll start with Teresa again, and then we'll change it up.
Thank you, Chris. It's an awesome question. So for anyone who may not know, St. Luke's is a nonprofit health system. And as a nonprofit, we receive tax benefits on the properties that we own where we provide patient care. So we own a lot of other properties that maybe we lease to other physicians. We pay taxes, but by and large, there is a significant portion of our work that is not taxed. As such, we have a responsibility and a requirement by the IRS to reinvest funds back into community benefit. And that can come in a variety of ways. It can be in new technologies, it can be in physician, provider, nurse education, it can be in providing indigent care, charity care, and it can also be through investing with community organizations, other nonprofits, governmental organizations, school districts, for what is determined by the IRS as community benefit. And there's many ways that has to be measured. So it's our responsibility to be investing in each community where St. Luke's operates. What is very exciting is through utilization of, I would say, resources like Chris Stanley's Healthy Conditions Assessment, or working with Alexis on this 10-county community health needs assessment. We have the responsibility again to assess community significant health needs in each community where we have a licensed hospital. So for us, that's 6 community health needs assessments. And it will tell us, based on qualitative and quantitative data, what the most significant needs are in that community. We have realized over the maturing of our process and utilizing other experts that it's not just a diagnosis code. So it could, a community health need could rise to the surface that is around obesity and diabetes. So it isn't enough for us to say, Ada County, you have a significant issue with obesity and diabetes. We then have to create an implementation plan that we provide to the IRS that demonstrates what is St. Luke's going to do about it. And in working with some of who I would say are some of our best minds nationally, we have learned the way to do that is to do a collaborative plan. So we will look to Chris Stanley, we'll ask Vitruvian to do a healthy conditions. He will give us the data that says down to the census tract. So further drilled down than zip code, because you often hear your zip code will determine your health. We have learned in Treasure Valley, you could have a zip code, for example, in Garden City, where we know many of our residents may live in trailers. It's the same zip code as neighbors in Hidden Springs. So the zip code isn't enough of data. So we'll go down to the census tract. Chris will be able to show us, like in Nampa, there are food deserts, or there's a freeway that's dividing access within less than a mile of a neighborhood of poverty to get to a grocery store less than a mile away, but divided by a freeway. And so it's become incumbent upon us to recognize we have to drill even further into data that we're not experts in, yet we know amazing community partners. We can have access to that data. And then how do we affect our patient outcomes by pivoting into the community, taking this responsibility to invest in our communities on tangible programs that could address, for example, the food desert. We have, what is thrilling to me right now is we consider our care that we provide within our 4 walls, we define that as population health. And I say that because areas nationally may define community health as population health. So inside the 4 walls, we have patient responsibility. Like the 4 walls, we call that community health. We now have our safety and quality folks inside our 4 walls looking at a tool provided by Vizient. It's called their Vulnerability Index, and it focuses on social determinants of health, which is outside our 4 walls. And so I work with our now population health leaders. We've identified 39 zip codes across our footprint where people have rising risk of diabetes and they live in a vulnerable food desert location. So now it's my responsibility to work with our team to support other organizations that help us fill that gap for nutritious foods, whether it's a grocery shuttle, solving for a transportation barrier like a freeway, and how to do that. So for me, it's just very exciting. And I would say that's also my aha moment, Chris, is all the amazing data that's available, probably by many of your relationships or your affiliations or even your professions, is needed now in the the health sector so we can be part of a solution because we have a responsibility to all of you for our tax benefits. Thank you.
Well, I would say that from my ACHD realm, planning and building to support and preserve health also connects with economic prosperity. We also have a duty to make our infrastructure accessible for all users. With ADA, we have to make things ADA accessible. We have to make things accessible, not just from that lens, but and I think we talk about this a lot, complete streets, or, every user at every age should actually be able to traverse our built environment. And that then equals health. That then equals independence and freedom. It equals the ability to, like what Teresa mentioned, go to that grocery store, go to the job. It also incorporates and bakes in resilience, against climate change, against when you lose your job and you can't afford your car, you can walk or bike to wherever it is that you need to, work. I think about when I lived in the East End and it was before Snowmageddon, and we had a very big snowstorm, and I worked for the state at the time. And, I was in that early 20s time frame in my life where, you don't have very much money to your name. And if one car accident on a snowy road could render me homeless and having to go back home, right? And I thought about that and just why isn't it easy for me to be able to go to the state house where I work? And I live just maybe a mile and a half away. And so I think all these pieces are interconnected. And one of my pet peeves are that people in elected office or in leadership positions just look at health from a health perspective on a one-off, when really health and that framework needs to be across the agency. It needs to be, how do we support the health of our employees? How is health incorporated or supported in every project that we do? How is it part of our policies? How do our policies impact the health and well-being of our communities, right? And so I think, again, it needs to be all-encompassing and not just, oh, we did this livable design guide, or we measure for level of traffic stress for bicyclists or pedestrians. Like, that's a great step, but that's not the full picture. And I would just, on the public health side too, there was a recent Washington Post article, I believe, that kind of read the room, but it was like, there's no magic pill that is ever going to cost enough to diminish diabetes or to prevent all of the suicidal ideation that is gripping our country and our state. What will support the health and well-being and save us money is built environment improvements, as simple as sidewalks, as simple as more tree canopy, right? All of those things have a greater impact on those health outcomes and those healthcare costs than a little pill can.
Yeah, great points. From the transportation professional side of things, what I think of, why should we care about public health? That was the question there. Is whether we work in the private or the public sector, we're working in the public realm. We're working with public right of way. And so I think, putting on my hat from when I was an economics major as an undergrad, we got to maximize the use of the public good for the public benefit. And that's, a lot of times we think about that in terms of, commute times or things like access to jobs. And those are important measures, but they're not the only measures. I love efficiency, being able to use something to accomplish multiple things at the same time. So if you can turn your work commute in a way to help prevent diabetes and improve your mental health, well, that's, you're hitting a lot of things right there with your simple 15, 30-minute activity you're already having to do. I think those are great opportunities. I think the other thing from the health side for transportation people is I also, we talk a lot about preventing, preventable diseases. I think there's probably a better term for that. I'm forgetting it right now, but things like diabetes and heart disease and whatnot. It's also, making sure we're creating safe places for people to walk, bike, as well as drive. I think another health element is trying to create places where people are less likely to die or be severely injured in a car crash, regardless of what mode they're taking. That's also, I think, a healthy element too.
Great. And I think it's important. I think you kind of touched on both, several of you touched on this notion of health. So let me ask the audience real quick. When you think of the word health, what's the first thing that starts to come to your mind? Is it physical health? Is it the diabetes? Is it obesity? Is it the things that come along? Cancer? Is that where it is? Because that's part of it, right? But think about the last time you went for a purposeful walk. Was it to be in nature? Was it to comfort a loved one or a friend? Was it your dog walking you? Was it to go buy something, right? All of those things describe different parts of health. And I'll give you, this is just my tip for what it's worth. We've been using and we've stolen, borrowed the heck out of this notion of this called the 7 dimensions of health and wellness. And physical health is one of those things, but environmental health is critical. Social health, as we've learned from the pandemic, right? Mental health is incredibly important. Social interaction is absolutely essential to a healthy life. So it goes beyond even the obvious. So my next question is going to be about the role that private health-focused organizations might play. I'm personally a firm believer that I think as a planner, we're very guilty of overusing the term stakeholder. And I'll tell you a word I like better, and that word is shareholder. Because I think when we say stakeholder, it implies that everybody's voice is completely and utterly equal. Teresa, is St. Luke's voice pretty significant in the state of Idaho? I would think so, right? I look at it as a community, sort of like a mutual fund, where we have investments that are a little more percentage here, a little percentage there. Everybody contributes, and we have to engage all of those folks. But there's certainly a role and responsibility that might be different from one stakeholder to another. So in that vein, I'm going to ask you this question. So how can private health-focused organizations, and I just told you health can be defined in a lot of ways, help shape transportation policies and plans? Nick, I'm going to put you on the spot first with that one.
Yeah, sure. I'll start there. And so I think there's some different ways. A very obvious, impactful way is to provide funding and to help lead plans. One of my favorite projects I've ever worked on was actually entirely funded and led by a community health organization in Southern Oregon. They conceived of the project idea. They got their own grant funding through a public health grant to first fund our planning study, then our engineering, then the construction of the project. And that was very impactful for that city because they were interested in the project. Smaller city with a low budget didn't have the opportunity to do too much. They're like, well, we can barely keep our roads paved. We're not likely to invest a lot in new infrastructure. But this organization came along, led the whole thing, great community support, wonderful project, very fulfilling to work on. So there's that. And then there's other ways, participating, being a very active participant in projects or in policymaking decisions at hearings and providing written or spoken testimony. I think being a visible voice and advocate for the health side of things and being a strong partner, I think, lends a lot of credence to the idea when it's a major public health or hospital or other health-based organization, versus just us transportation professionals.
Anything to add?
I would just, maybe it's adjacent to your question, Chris, but I'd like to say that, I think all community shareholders or stakeholders have skin in the game in terms of participating and benefiting from these investments when it comes to the built environment. And I'll give you an example, and it was because of my, relationship and work working at Central District Health. There was a neighbor to our facility that was getting developed just recently. It was a couple years ago. And there's a trail along a canal behind Central District Health. And, and we share it with Winco, we share it with all these different groups, right? And that canal pathway, even though it's not paved, it's gravel, we can connect to our neighborhood and now a new park, Mariposa Park. We use that pathway all the time, and it's because I had relationships with the city of Boise and Zach Pipemeyer at the time, where I was like, hey, this new development is happening. Can you make it a condition that this new neighbor doesn't shut down that pathway so that all of us can then continue to enjoy and benefit from a health perspective, from a community connectedness perspective, to enjoying that pathway? And luckily that was part of their application, and it's still preserved today. So I think from a health perspective, that's an example of employers, advocating for their employees. Obviously, my director, Russ Duke, supported that and provided a letter of support to the city. All of those things have a tremendous benefit on the lives and well-being of your employees. It gives them stake of ownership and trust in the government process as well, that, oh my gosh, the city is working closely with us and understands the value of these networks, right? This infrastructure. And so I think it's not just, it benefits employees, it benefits the greater good, and ultimately that's the goal in public health. It really is to invest in a wide variety of ways, going upstream and not discriminating if it's within our own four walls or within our county footprint.
It's not just about water bottles anymore.
No, it's not.
All right.
Chris, I would add, I so appreciate Alexis' orientation to going further upstream, and from a healthcare setting, we have learned through studies of the CDC that in order to impact the health behaviors of many people, rather than the health fairs where you might influence one person, or the health classes in elementary school of, not to have so much screen time and reduce your sugar intake and get an hour of physical activity, and they return home further upstream to their neighborhood where there isn't a safe walking path, or there isn't a sidewalk, or there are not street lights. We have learned from our responsibility as well as our obligation for community benefit that it's critical for us to look at opportunities that we're not the subject matter expert, but again, we either have the motivation for patient outcomes, improve patient outcomes, or we have the motivation for investing in the communities for us to do that work. And I would say a couple examples that I want to share with you, because in your own communities where you have a health system or a healthcare provider, I would say we don't know necessarily to do this work in this. The whole community health is such an important newer focus for all of us, because we're going to have a decline in reimbursements, frankly, from the federal government. So what can we do to ensure either community members stay healthier, or where they intersect with health care, that they're going to have better outcomes? And transportation is just so significant when you think of the social determinants of health. Transportation is one of them. The built environment is one of them. And where we have had some really great success, it's where we've leaned in to another community partner for that solution. So Rides to Wellness, Valley Regional Transit discovered a federal grant that needed matching dollars. So they reached out to us. We never would have thought of investing in Valley Regional Transit. And from my work with the city, I know the kind of funding they get from cities. And so when we realized in talking with our social workers that one of the significant factors that lead to hospital readmission or additional costs to a patient who has had maybe a joint replacement is that when they leave our four walls, they don't have transportation for the follow-up therapies, to go to the store to get their groceries, to get their prescriptions, to come back for follow-up doctor's appointments. Could lead to infection, other complications, and then their outcome lessens, the cost increases. And so for those of you that are in this space, think about reaching out to health organizations to be your partner by funding or helping with matching grants. So there's another example, but I'll hold off. But if any of you are in the McCall area, I'll share that one with you.
Excellent, excellent. Okay, this is a question I hope you can dig deep and be super honest with us on this, because I think it requires us to dig deep and to actually reflect and to think hard about, all right, what is our future looking like here? So my question is, so in your opinion, is our future healthier or is it unhealthier? And so, and basing that on what you see that's being done today. If there's examples, especially on the healthier side, that'd be great to kind of to give us additional context. But what is your thought? Are we in for a healthier future or an unhealthier future? Alexis, you haven't gone first yet. I want to pick on you. Go for it.
I'm sure the rest of the panel is going to be able to jump in on all the things that I missed, but I would say, looking at the data, we know that in the first time in years, perhaps even decades, our life expectancy has decreased as a country. And that's a really big problem. We've made tons of strides in a lot of different ways, but clearly things are still broken. And that's even accounting for the pandemic. So the short answer is no. But I think I'm really proud of, in light of that, I'm still really proud that there can be progress, that we can change the course of where we're headed. That also is kind of human nature. We like to just sit back and wait for somebody else to do the work until nobody else shows up, and then we just do it, right? And so I think ACHD is doing some really important things, doing some really important projects that hopefully will continue to support communities for generations. And I think that's something too is we looked at, and prior to me being there, and I think the old model was, looking at projects as a one-on-one, like, let's go in, come out, let's do this and do that, and not have a full, deep understanding of the community needs, or what are the pinch points in terms of safety, or what are the true concerns of the community, and not having that deeper dive into into the root cause of some of these challenges are, because then that allows us to invest our money more wisely and address a lot of those concerns and not just alleviate one or two, and then having to come back and rip up what we put down 5 or 10 years prior. And so hopefully, I think we can, one, be more intentional with our investments, that we're not having to go, and we can continue to build momentum. We can be really good about building those connections, and not just so that an entire neighborhood could benefit from a couple of investments rather than just the singular one-off streets or neighborhood blocks. And then I also think, from my public health lens, is more than ever before, a lot of us are working together, and that's not something that comes easily or naturally for a lot of partners. And I think much the testament to our local leadership, and Teresa is definitely one of those visionary leaders in our community in Idaho. They're realizing the benefit, the shared value of working together, of how, if we work together, the greater impact we can all have and share in those impacts. So I think I'm not a pessimist, but I think if we continue to work together to get the right people in those right seats and push our leaders to think bigger about these shared challenges, hopefully we can stave off the trajectory that we're on.
Great.
Alexis, I love working with you, and I'll be your counterpart. I am very optimistic because I think the future is going to be healthier for reasons that there is, like Idaho Walk Bike Alliance is statewide. It is leading, and Cynthia, you're leading phenomenal work in the State House with funding, with policy change. And we haven't had that around for very long. And so to me, that is just a really exciting example of the landscape is changing. I would also say, just back to my original comments, those of you that have greater understanding than in this space, in the built environment, in the transportation space, than someone in potentially the healthcare space. I would say multiple of you in this audience have challenged the work that we have done at St. Luke's, whether it's in facility development, whether it's the road closure and creating alternatives that may not equal what the road provided. But I have been, in the last 9 years, and then cutting my teeth with the city of Boise, the mayor and city council, challenged, educated, brought into conversations I wouldn't have known to even ask if I could be at the table. And all of that is cultivating, in my mind, such a great foundation on which this work will continue. And again, from my perspective with the health system, if you have patient population that 50% are Medicare or Medicaid, and we know that the federal government's going to reduce our reimbursements, it is not sustainable for us to just sit on our hands and not do anything. We have to be involved in the health of people in the communities so that when they do come into our four walls, we have a better chance of improving their outcomes and not requiring more reimbursement, because it won't be coming. And so I think that now more than ever, we have the foundation of these incredible organizations that are leaning into the built environment space. Healthcare has this newer understanding that we have to be an active participant. And so I'm excited about the future. I am grateful for many of you in this room and the work that you have done, shoring up a foundation.
Great. So Nick, I'm going to give you a chance to answer that question, but just as he concludes, if there's anybody in here who does have a question, I think you need to come up here, right? And make sure. So if you want to just kind of queue up over here, that would be great. So Nick, go ahead. What are you thinking?
Yeah, and I'll also just I do have to leave here in just a couple minutes. If you see me get up and walk off, it's not because I'm disgusted with what anyone said. I have a stakeholder, sorry, Chris, stakeholder meeting that I have to get off to here in a couple minutes. I'm somewhere in between. I'm cautiously optimistic. From a built environment perspective, we're seeing a lot more investment in walking and biking infrastructure. After years of safety being kind of a token lip service thing, it's a priority. We're seeing the dollars put to that in the last several years, and it really means something. Where we're having conversations with state DOTs where you can see like, oh yeah, but the congestion, but you know what? No, safety is our priority. We're going to make that change. I've got a project right now where that's going along, and I can see the conflicts going on from the people who were used to the last 30 years of how they've done it, and now how they're trying to prioritize safety maybe more, and what that might lead to. And so I'm cautiously optimistic in that area. And then I'll just, say from what I see from the younger generation of, the people who are entering our workforce right now and what their priorities are, both with the work they're doing as well as how they handle their personal life and boundaries they place on things, it looks a little different than what I was doing at their age. And I think it's, I think it's for the better. And so I'm cautiously optimistic from that perspective. Yeah.
Chris, I'd just like to add one more thing. I want to mention too, building onto that point, is right now we have this tremendous opportunity with all of the federal infrastructure dollars that are coming in and available to our states, and with the guidelines that are attached to that funding is exactly what our country needs right now. We see, and Garden City is in my district, and Chinden cuts off that community. They're landlocked, depending on what side of Chinden they are, and people will continue to die on Chinden unless there is something done about it. And I think finally these dollars and these requirements are finally getting state governments, electeds, other people to finally shift gears, and begrudgingly in some cases and enthusiastically in others, to say, okay, this is the right thing to do. We will, approach this funding. And I think we won't be able to really understand the true benefit and impact of these dollars coming back locally to our county and our state for generations to come. And so I'm very grateful that, ACHD is a recipient of a RAISE grant. VRT, State Street, and the city of Boise worked really hard to bring that funding to our communities. So I think if we continue to do that, we'll be on the right track.
Great, great. Okay, so conferences like this, a couple of you, it's the first time you've been back in person. Let's make it count. What I mean by that is the call to action. Lightning round, quick answer here. I want you to list for me one thing that you think anybody in this room can do tomorrow to advance this discussion. Tell me, what's something that all of us have the ability to do in one form or another, but is that action step? What is it?
Engage your local health systems.
Can you elaborate? I'm going to give you a little longer lightning.
Sure. Let us know when you need a partner for a solution, especially in transportation, because likely we need the same solution. And we're not the experts and we don't know how to pull together, for example, a shuttle program to assist with our renal dialysis patients. So reach out to us.
The Teresa McLeod hotline.
Yeah.
All right.
Reach out to me and I'll connect you.
All right. It looks like Alexis has a quick answer. What is
Yeah,
it?
I would say vote. That's my short
Vote.
answer.
Yes. Right. That is upon us.
Vote, right? Vote for leaders that understand these nuances, that aren't looking black and white at these big decisions and investments. And echoing to Teresa is get involved, whether that's an advisory group, testifying in front of commissions or the city of Boise. We literally get a handful of people at these very important meetings. And I know it takes work. I know there's barriers to getting involved and engaged, but I guarantee you there's a lot of us that truly value and treasure your testimony and your perspective, and continue to give us your time, give us your energy and your perspectives, because we need them to make better decisions.
Mine's related. It show up. Your voice does matter. It may not always feel like it does, and you may not always get the outcome you want. But I've been to enough hearings in different municipalities or different levels all across the region, and I've seen votes go ways I didn't expect them to, just based on the people that showed up. I've seen projects whose outcomes were drastically changed for the better, based on public input in ways that, to be honest, sometimes I would have missed otherwise too, just as the professional. So it does matter when you put the comments forms in, when you show up for a public hearing.
Excellent. So in the time that we have left, do you have a question? Oh, we've got a question. All right, let me turn this, or just come this way, it's fine.
Thank you to the panel for this amazing discussion. My name is Paul Reyes. I work as a contractor for the state of Idaho temporarily. My background is in geography, and I'm a geographic information systems expert. I think that the topics that we are discussing right now are very tightly related to geography, to the location of things. And you, Teresa, you mentioned that access to data is key. And I think that data, moves the world now. So I see a really good opportunity where perhaps the get together with the state to foster this need for geospatial data. Right now, I'm working on a project that I talked to people working on this project for 20 years, and it's the same project, and it's not moving very fast, and it's the same idea of we just want to have a state layer of parcels, and it's a good idea, but the type of data that you are requesting now is much more valuable, and so if we can get your help into that, letting know the state that is need to have really good data, a really detailed scale, that would be very beneficial.
Fantastic. Thank you so much, and I'll connect with you. Thank you.
I'm going to squeeze every minute I can. Last question for you. I know Nick's got to get going. But I think I'd be remiss if we didn't take the opportunity. I mean, Abe Lincoln is staring at you, right? I mean, so in 3 months-ish from now, these chairs are going to be filled. This building is going to be filled, and there's going to be some decisions that are made, critical decisions, as we know. What's your message? What's your message to the people who are making the decisions in this room about the future of Idaho and specifically around transportation and health?
To follow Nick and Alexis' guidance, my understanding is that the incoming legislature is going to have about 50% new members. And they all have their own subject matter expertise, and I doubt that any of it is community health, population health, transportation, social determinants of health. And I know from our St. Luke's perspective, we are doing what we can to have educational papers. You know, that we are an expert in some areas, and so how we might inform the incoming body, especially considering 50% will be new, that is something we're spending a lot of time on. And it is a challenge to educate a part-time legislature. So however we can show up, be present, share our information. And I will be very frank, for St. Luke's, while we do have a tremendous tax benefit because we're a nonprofit, we still pay taxes on, I would say, at least a third of our operations, our facilities. Our primary concern is I would say, to ensure that we retain our not-for-profit status, because there are electeds that want to take it away. And it's based on perhaps not their full knowledge of where we are providing community benefit, and a for-profit hospital doesn't have the same ability to do that with indigent care, charity care, the investments that we're doing. And then secondly, ensuring that the Medicare and Medicaid dollars are preserved. That's significant for us. And so for St. Luke's to be out front vocally about transportation solutions can be misconstrued as lobbying, advocating, getting into the policy work where they don't want us. And then they raise, well, maybe you shouldn't have a not-for-profit status. So for us, we are looking at partners that have the mouthpiece. How can we support them? You know, Idaho Voices for Children, where we fund them because we know they can advocate in front of the legislature. Idaho Walk Bike Alliance, others, any of you that are able to be lobbying, to be advocating. If you need support behind the scenes, please let us know. Thank you.
Alexis, you're really shy about your political philosophies, right?
I
In the
would
last minute, what do you want to tell the
I would
incoming
say we
legislature?
have a lot more in common than you think. You know, I think so many of us have our, you know, our little hills that we protect and think that we're going to die on. And, you know, my experience in Kuski is a very shared experience across the state. And we still have places in Ada County that reflect those lack of investments. And so just because, you know, I'm coming from an Ada County commissioner role doesn't mean that I don't understand or can or intrinsically want to see improvements also be had and seen across the rest of our state. And so I feel like there's this tension between state and local. And I think, again, we have way more in common than you think. And I think, again, listening, working collaboratively, listening to each other, that's going to be what gets us over the finish line and ultimately helps them write good legislation as well. We all want to see our communities thrive. And I think ultimately working closely with the people that are going to be most impacted, whether that is a transportation funding bill or something else a little bit more polarizing, having that local context and being able to listen to those locals is going to help them tremendously.
Excellent, excellent. So in close, something to think about, in the early 1900s, the city of Chicago reversed the entire flow of a river. Think about that. They reversed the entire flow of a river in the name of public health because of how sick it was, making its citizens. If they can do that 120 years ago, I think we could do things like put a sidewalk in, right? Like, I'm pretty sure we're capable of those things. But hopefully, our panel has left you a little inspired and certainly a little more knowledgeable on this intersection of public health and transportation. So we want to thank Teresa, Alexis, and Nick for having this discussion. Appreciate it. Any questions that you all may have after the fact, I'm sure they'd be happy to answer them. So let's give them a round of applause and thank you for your time. All right, 15-minute break, and then we'll reconvene.
Yeah, and thank you, Chris. That was excellent. That gave me hope. We're going to take a 15-minute break, and then Elaine is going to come up and present. I have two things, though, that I'd like to say as a follow-up. One is the reason why we host this event here in this building is because I want you all to get more familiar with it, because it's really lonely during the legislative session when I am standing up there by myself testifying for or against a bill, and I'm the only person doing that. So, I encourage all of you to get really involved in the legislative session if you are interested. I didn't come into this for 20 years that I lived in Boise, literally until I got this job. And then I remember the first day I walked in here, it was terrifying. It still is. And the other thing, election coming up in a couple of weeks, so vote. Okay, we'll see you back here in about 15 minutes. Thank you.